Hey everybody, how you doing today? This is Dr. Damien coming today for your new video, next in the line of the series, ABCs of Common Diseases. Give a little background on myself. I'm a family practice physician here in Houston, Texas with over a decade of experience, and I'm bombarded on a daily basis with people who want to know a little bit more about their common medical conditions, and I thought that this would be a good way to kind of educate people. Today at C, we're going to be talking about COPD. COPD is a big deal. Probably 329 million people in the world suffer from it. It's about 2.9 million deaths in 2013, and it probably will rise as the population gets older and more people start smoking. You'll start seeing more people with COPD. COPD is chronic obstructive pulmonary disease, and if you take a look at what it is, it's kind of like, use this example, it's kind of like a milkshake. When you have a straw in your milkshake and you want to taste the milkshake, you suck up the milkshake into the straw, and it's pretty easy to do. But if you were to reverse that and try to blow back into the milkshake, it's kind of difficult. It's kind of difficult to make anything bubble up like you could do with water or some other liquid or whatever. And that's kind of how COPD is with the breathing. Most people with COPD are able to inhale very easily, but exhaling is the problem. This type of thing causes people to have the following symptoms. So you would say, what are the symptoms of COPD? Most people will say that, I've been coughing a whole bunch. So if somebody comes to me and they come into my office and they say, I've been coughing for the past 3 months, and I usually cough around about this time of the year, and for the past couple of years it's been going on. This is one of the main symptoms of somebody with COPD, especially if they're a smoker. The next symptom that a person would have is that they feel like they're short of breath. And short of breath is just usually patients say, no, it's kind of difficult for me to breathe, or I'm having a hard work at it. I'm having a hard time at this breathing. So then that lets me know this may be COPD as well. When a person comes to your office and they have COPD, I usually use a little test called a spirometer. And a spirometer is a test where you have to kind of blow into you take a deep breath and you blow into a little tube, and that kind of measures and lets me know how your breathing is. The way that you get, or the way most people get COPD is, number one, here especially in the undeveloped world as well, it's tobacco smoking. 20% of people who smoke will end up with COPD. Some other things are environmental hazards, air pollution, people who work in factories with poor air quality, and in the undeveloped world, third world countries, people who have fires, that they burn fires inside their homes, their habitations. So what do you, as a regular person out there, or as a patient out here, what do you do if you have COPD? Number one, if you smoke, stop smoking. It's as simple as that. People who stop smoking, their lungs have the remarkable ability to heal themselves. So if you stop smoking, you're doing yourself a plus. Number two, if you have air pollution or you live in a place with air pollution, you have to reduce your exposure to these things. Also, like anything, being overweight causes you to have hard work of breathing. Also, this is a funny deal, you probably won't hear this much on my series, is being underweight also can cause you to have problems with COPD. So if you're underweight, you should increase your caloric intake. So what if you already have COPD and you've tried to stop smoking, you're still short of breath, or reduced your exposure to a lot of the pollutants in the air? Well, the next step will probably be medication. And the medication is usually aimed at making your air tubes, or your bronchioles and your tubes that go to your lungs, to dilate them, to make them bigger. So that's usually how those things do. And we use that with medications called bronchodilators and steroids. So these are not the steroids that make you strong. These are the steroids that cut down on inflammation and also widen up your airway. Think of my straw analogy again. So if you were to make your straw wider, then you can suck in more milkshake, and also then you can blow on it and make more milkshake. So I guess to recap, COPD, chronic obstructive pulmonary disease, usually caused by smoking. That's the number one thing. Air pollution, environmental hazard.